I think health in any community is very important. Doesn't matter where you are or what culture you belong to. You know, we need to care for not only ourselves but for each other.
The thing that I really love about working in the Torres and Cape is my interaction with the community members, being able to know them on a professional and personal level.
The journey to work is less than 10 seconds. So that morning peak hour traffic you get to miss, and it adds time that I can spend with my family.
The people are just so beautiful. They're genuinely good people. It's a safe place to live. It's a great place to bring up children.
Kapukot muzinel noma ngai gamuleg atlak netumunai walmani muzulaga ka kay meso.
We have 34 facilities, and we have 4 hospitals, and we have 30 primary healthcare centres. Of those primary healthcare centres across the Cape and the Torres, a number of them are for very remote communities, and they're such interesting places to live and work. And in those remote environments, clinicians have the capability and capacity to be enabled to work to their peak of their scope of practice.
Being rural, you get a lot more autonomy within your practice. You get the opportunity to develop your assessment skills, your clinical knowledge and sort of the scope that you can work in.
From going from a quite specialised service where there was lots of subspecialists to having to provide care across a diversity of presentations and different kinds of medical conditions. So that was a huge adjustment for me, but I felt really supported in that and actually really enjoyed the learning that comes with that.
So many unique opportunities here. I mean, the things that walk through the door, the autonomy that you have, you know, it's very much a, you need to work with what you have. You know, you might not have everything that you'd have down south to maybe treat something or to provide to someone, but you need to be really skilled at finding what you have in the clinic and in the community resources and provide that good healthcare for them.
So your day could start off with taking a helicopter out to an outer island, flying over dugongs, flying over turtles, and then being able to land and just have a day out in the community, being able to really work with the primary care teams on the island to be able to provide really personalised service to the community as part of a multidisciplinary team.
If you know your patients really well, they come back to you, so you have really good continuity of care. And you can tell when they're sick because you've seen them when they're well.
The community need to be able to have trust in you that you'll follow up and you'll give them the advice that's going to help them be the best that they can.
I just bought this fruit for Guy and his team at the Laura Clinic because they're doing such a great job.
In our communities in the north, where we have clinical nurse consultants, we have Indigenous health workers that work alongside with them in the clinic and also outside in the community when we're doing home visits. This is to ensure that any clinical information that is passed down to our clients are understood by the clients.
And we're here to help them and they're here to help us.
And they keep us culturally appropriate in our care, which people don't know how to do until you've worked with First Nations people.
When I was new onto the island here at Mobiag, I utilised my health centre manager, Norma. She was amazing and introduced me to some cultural mentors on the island, and just assimilating and becoming a part of the community in a culturally appropriate way, I then gained respect.
Coming up here, I've learned so much about the culture and I've met so many family members, and it's only been a year, so I think it's the best decision I've ever made in my life.
Not everyone's suited to remote. It can be hard work, you have to be flexible. You have to have a bit of a sense of resilience and humour.
Within the first week of arriving, I met my best friend. We just have the best life. I was like, we're actually not going to leave here. Like, it's so good.
That feeling we get from helping people, you know, that's probably the most rewarding part of it.
Best, yeah, that's right.
People have come here and have never moved away. They've come here, they've married, they've stayed here, or they go and they always come back.